But my background as in the medical field of studying, um, as a respiratory therapist, it afforded me to have a, good understanding of how the body functions, lung physiology. And so when I was introduced to the Buteyko method, and how I was introduced to it was basically I was searching online, looking for ways to assist my patients, because many of my patients were asthmatic, had lung problems, lung COPDers, constantly looking for a way to get better results. I came across the Buteyko method in the Breathing Center. And because of that, I was extremely grateful because I just found that in my experience working in the medical field, we were not accomplishing the results that I was looking to accomplish. I wasn't satisfied with patients coming in the door, treating them, and then them leaving the door, leaving the hospital and being discharged. And then, shortly after, some time, a day, sometimes a week, sometimes a few weeks, they're right back in the ER or in the hospital being treated for the same thing. And so that over time, because I'm more of a holistic mindset and looked at things from a holistic perspective, not just treating symptoms, that always bothered me. And so that's why when I came across the Buteyko method, I was able to, one, grasp a lot of the concepts fairly quickly because of my background, but two, can see how it can be implemented and have a lot of positive um, effects just based on the principles. And then going ahead and applying the principles really supported and proved my assumptions. And also, we'll talk a little bit about what I've been seeing in the hospital. Now, once again, I'll be transparent with you, and that is not everyone is, you know, understands Buteyko in the hospital or has totally accepted it or taken the information and run with it. I find that the most effective way, because when you're dealing with the medical community, they already have their mindset on what works, regardless of the outcome. And I say that that's unfortunate. I don't work that way. I work, in a fashion that, if something is working, even if it's, different than what I had presently thought of, if the results are there, I'm a person that are more moldable. I change my perspective, which is one of the reasons why learning about this method, why I did change my way that I treat my patients in it within in my scope. So what I had to do, and these are some of the things, maybe some tips for you folks when dealing with the medical community, when in the environment of the hospital. Because you got to remember, when you're in the environment of the hospital, you really don't have control. If you're admitted by the hospital, you're really under your doctor's care. So you have, as a family member, you have limited say-so. You can make suggestions, but really they're oftentimes not open to your suggestions. So if you come and speak with the medical community from a pure knowledge base, oftentimes you will be shot down or not taken seriously. So what I've done was try to think about what is it we're actually trying to accomplish, and speak with the doctors uh, based on their language, based on their terms. Um, so when we talk about decreased breathing, you know, we talk about, instead of not speaking about hyperventilation, which I find, most doctors have a different view of what hyperventilation is in comparison to the Buteyko method. So understand that when you speak about hyperventilation, from my experience, they will, for those who are experienced, they will view that totally different than the way you're interpreting it. And oftentimes that will right away shut down their openness to what you have to say. So I speak more in lines of, you know, decreased breathing. And let me give you an example. Um, One of the things that was a positive through this um, experience with COVID-19 was that because patients were having difficulty breathing, because they were experiencing low saturation despite as much oxygen and medication and stories that they were throwing at these patients, they started to think of alternatives. And one of the alternatives of treatment, which was like to my surprise, but really flowed right in line with what the Buteyko method, almost accidentally, was that they started to prone patients. Proning means instead of laying on your back, laying on their front and having patients um, lay that way. Now, right away, uh, us who are experienced with the Buteyko method understand that one, that's one of the principles of how we teach, which is one of the most effective positions in sleeping. Why? Because it promotes decreased breathing. It promotes relaxed breathing. Um, Instead of having, when someone has a difficulty breathing, their breathing is oftentimes noisy. You know, their chest is moving, their belly is moving because they feel a sense of breathlessness. But when laying on their stomach, it helps to calm and promote the relaxation of their breathing through their pressure, and helps to build up your level of CO2 from Dr. Buteyko's perspective. But in the hospital, they don't know that. But they just, first, they started doing it with ventilated patients. And they noticed that by proning them, by placing them not on their back, but placing them on their stomach, that they had an improvement in their signs and symptoms. They had improvement in their oxygen level. So it started with patients who were on ventilators, and they noticed an improvement. Well, when I saw that, my thought was, oh, that's the proper way in which the best way, if someone is sleeping, that's the best position that they can be in. And so it sort of supported that. Then it transitioned into, before they even were on life support on a ventilator, they started doing this, and lo and behold, they noticed an improvement there as well. Patients prior to proning, they were on 100% oxygen. That's as much as oxygen that you can give them. Then, because they were still having a difficulty breathing, they oftentimes would get intubated as a direct result. But when we started proning some patients prior to intubating them, we noticed that they were also improving. A patient who had a saturation of, say, in the 80s with 100%, all of a sudden we put them on their stomach. Now their saturation, just by that adjustment, goes up to 94. That literally happened maybe a day ago when I was on shift. We were about to change a patient to an additional oxygen therapy because they were on 100%, and this patient was moving towards getting intubated. But I made the suggestion, why don't you just prone this patient, put her, and before we, make these additional adjustments. Well, they did. Her saturation went from 88 to 94. And we didn't have to make any adjustment in the therapy, and we didn't have to change this patient's room, because we would have had to change her room if we were going to do this additional therapy. So these are that's one kind of positive signs that I'm seeing. So these changes are not only coming from me, but because doctors are realizing what they presently are doing, they're looking for changes, making changes, and they've stumbled on oftentimes things that work, but kind of fall in line with the Buteyko method, which is, very interesting. Then what I've been doing also is trying to work with the doctors and encourage them, because one of the principles of the Buteyko method is decreasing your breathing. If a person's not on a breathing machine, they can do that themselves. And that's the focus of our training, of showing folks how to uh, breathe less in general, like making lifestyle changes, but also specific exercises that we do that help promote decreased breathing and help promote decreasing the loss of CO2. That's what we do at the breathing center. But when you're on a ventilator, that patient has no control over decreasing their breathing. So what I've done is really speak with these doctors and try to encourage them to adjust the ventilator settings that would mimic and do the very same thing. So low volumes, um, like I said, unless you're in the medical field, some of the terms that I'll use, it could be a little confusing, so I won't get into the weeds, but just in general, making some adjustments on the breathing machine so that way it would mimic decreased breathing. Why? So that way it can decrease the loss of CO2 that we are manually doing um, with the ventilator. And once again, I'll share some more experiences in next week's class. But I've seen it actually, for those who are familiar with the Buteyko, rest assured that even in that setting, even in a critical setting, just like the results that you may have gotten with your clients, I'm seeing the same results with people who are on life support. Whereas, yeah, so I'm seeing these things, the results of people who are on life support being able to get off life support significantly than your average patient who were not utilizing these principles. Um, from from people where we're not applying, where we're using higher volumes, which promotes hyperventilation, and to the medical community, that's normal care. When you talk about low volumes, to some are understand that the concept of small volumes being beneficial, but the majority, this type of therapy is viewed as aggressive. Patients are getting off of the ventilator much quicker. They're getting positive results by making these changes that mimic the Buteyko method that we normally would do with your average person. But the way they oftentimes view this, because it's different, is they view it as aggressive, even as we're getting results. Um, I still receive some resistance. Why? Because it's not in line with how patients are normally treated. But see, the reason why, one of the things that's motivated me is that COVID-19 virus has produced the rate of mortality, patients dying, anywhere from, if you're on a ventilator in New York, we're seeing that it's like an 80% mortality rate of patients who go on ventilators don't make it. We're seeing that not only in general, and it has a direct result from my perspective and understanding the Buteyko method as a direct result of not the virus itself, and this is my personal opinion, based on my assessment, based on the things that I've seen and making adjustments and seeing the results. That is direct result of not the virus itself per se, but the mode of ventilation, the way they're ventilating folks that go opposite to healthy breathing. I found that I found that to be very fascinating because we weren't able to see those kind of results, those kind of statistics prior to COVID-19. But with COVID-19, like I said, because of the increased amount of people who are requiring ventilation, uh, being placed on a ventilator, we're seeing those statistics that, those who are being ventilated by the traditional method, which is hyperventilation, 80% mortality rate.